Hello everyone and welcome to a new session on clinical pharmacology and drug therapy. Our lecture for today will be gout and hyperuricemia. I am Dr. Khalid Hassan, professor of clinical pharmacology and drug therapy. Let's get started. Okay, we will start first with the definition of gout. Gout is a metabolic disorder caused by elevation of uric acid in the blood. So we call this case hyperuricemia. So the definition for hyperuricemia is like increased level of uric acid in the blood, and that will lead to the disorder, metabolic disorder. Okay, gout and hyperuricemia. Speaking about prevalence in the United States, they found gout affect like 3.9% of adult, estimated 9.2 million individual affected nationwide. The issue here, gout is like significantly related to the level of uric acid, significant increase. So when you have high level of uric acid in the blood, this will lead to the significant increase of risk of gout over development over time. So when you make blood tests for the patient for the uric acid, if the uric acid less than 7 milligram per deciliter, the risk factor for 5 years cumulative risk factor will be 0.6%. However, if the patient uric acid level more than 10 milligram per deciliter, this will give you the risk factor 30% cumulative risk factor for 5 years. So as you can see here, when the uric acid increase in the blood, this will increase the risk of gout. So higher serum urate associated with a significant increase in gout development. Hyperuricemia and gout, the important issue here, not all cases of hyperuricemia results in gout. Maybe we can see some patients suffer from hyperuricemia without suffering from gout, but maybe the most popular case to see the gout. Many patients with elevated uric acid remain asymptomatic. This is an important issue here. The preference, they found gout increase with the increasing age. At age 80 and above, like 7.8% suffer from gout. Between age 20 to 39, they found 0.7% suffer from gout. So as you can see, with the increasing age, there is increased risk of gout. This is number one. So age risk factor. Number two, obesity is another risk factor. Number three, like alcohol risk factor, sugary beverage risk factor, red meat risk factors, sedentary lifestyle. When you sit on the maybe at your office for a long time and don't move, don't practice exercise, consider like risk factors. Also, men more risk at maybe gender, like speak about male at risk 2 to 3 times compared with the woman, for example. Okay, so underlying causes of hyperuricemia could be overproduction of uric acid or like decreased excretion of uric acid by the kidneys. So you have overproduction, decreased excretion, or combination of these maybe etiology or pathological factors. Again, genetic polymorphism of purine metabolism consider like important factors in the hyperuricemia and gout. Hyperuricemia, we diagnose the patient with hyperuricemia when the uric acid level more or equal 6.8 milligram per deciliter. The big issue here, when the uric acid increase in the blood, in the serum, what happened here, the uric acid precipitate as crystals, and this will lead to the urate crystal deposit, and particularly in the kidneys and in the joint and synovial fluid. So we have crystal precipitate deposited in the kidneys and in the joint. So as you can see here, the crystals precipitate on the joint and on the kidneys. We can see the crystal there, and this will lead to the arthritis, and this will lead to could be acute kidney disease or chronic kidney disease. Okay, and this may lead to the increased blood pressure, for example, or hypertension. So all these related to the hyperuricemia. Urate may trigger inflammation, granulocyte infiltrate phagocytosis, and initiate immune response. So you can see here we have inflammation, you have immune response during the inflammation things. So therefore we use NSAID, for example, to treat acute inflammation, acute gout inflammation. So when the patient here, due to the inflammation and immune response, some patients may suffer from acute gout flares. So the patient here is coming to the clinic, suffer from pain, swelling, tenderness, and redness on the affected joints. Common site for the gout will be the big toe, the knees, the ankle, the wrist, the elbows. I'm going to share some picture from Google Image to share with you the clinical aspect of gout. Okay, in this website from the Google Images, you can see here we have several images indicate the gout precipitate of crystals on the joint and cause inflammation, pain, and immune response. Okay, this is number one. Number two, we are going to speak about crystals here. So you can see the crystal here in this slide here. We can talk about crystals. Another image from Google Images, for example, you can see the crystals here like broken glasses. These crystals cause inflammation and immune response, triggering immune responses and cause inflammation. This inflammation could be acute inflammation. Uric acid crystals here, you can see it in several pictures there. So for this reason here, we need to emphasize on the role of uric acid and crystals on the two main organ, joints and kidneys. Okay, we here in this slide we are going to discuss the synthesis and formation of uric acid. Start from purine metabolism. In this slide, we are talking about healthy individual, normal healthy subject. So what we have here from the diets or from the cell turnover and metabolism, this will lead to the formation of purine, and purine considered like essential building blocks for the DNA and RNA. So we need purine for that. However, we know that purine follow the metabolism pathway, and this metabolism called xanthine oxidase pathway. So we have the enzyme turn the purine to hypoxanthine and hypoxanthine to xanthine, and under the effect of xanthine oxidase activate the conversion of hypoxanthine to the xanthine. So you can see here this enzyme is target for the treatment. So xanthine oxidase activate conversion of hypoxanthine to xanthine. Okay, and the same enzyme involved in the second step. So this is the first step here, convert hypoxanthine to the xanthine. The second step will be convert xanthine to the uric acid. Okay, now we have uric acid, and uric acid considered like strong antioxidant factors. Okay, so now uric acid will be eliminated in the urine. This is an healthy subject here. Okay, so you can see here we have our target 1 and 2 xanthine oxidase, and we have abbreviation XO stands for xanthine oxidase. We need to remember this abbreviation for the treatment application. Okay, what happened here? So we are familiar with the steps here from previous slide. The steps here, it's like repeated steps. They found here we have two medication. The first medication allopurinol, the second medication febuxostat. So two medication allopurinol and febuxostat inhibit xanthine oxidase, and this will lead to the inhibit formation of uric acid. Okay, so you can see now what we have, a role of uric acid in inflammation and gout. Okay, so due to the increased formation of uric acid, this will lead to the increased formation of uric acid crystals, and this crystal will be precipitate deposits in the kidneys and joint. Okay, so you can see the crystals now here. So our body in the urine tried to attack, tried to defense our system, our body system. So the neutrophils start to try to maybe involve in the phagocytosis process, try to engulf uric acid crystals. Due to this engulfing of the uric acid crystal inside the neutrophils, and we have in the neutrophils here we have small particles called lysozyme. Okay, you can see the lysozyme here, and this will lead to the type of inflammation and immune response, and this will lead to the release of the leukotriene. So releasing leukotriene, and not only leukotriene, they found also other inflammatory factors such as interleukin 1. So we have leukotriene, we have interleukin 1, and other factors could be involved in this process. Okay, at the end, when we have this neutrophils, kind of white blood cells engulfing, try to phagocytize the crystals and cause inflammation. This will lead to the death of the neutrophils and release of more inflammatory mediators. And you can see here we have death and rupture of the lysosome, and release the more mediator, and cause acute inflammation. So all these present the process of uric acid, the process of crystals formation, the process of acute inflammation response. Okay, before we start speaking about pharmacology, before we speak about the treatment, how to treat patients from gout, we need to exclude if we have any drugs involved in the inducing hyperuricemia and gout. We have a group of medication may cause or induce gout, such as diuretic. For example, we have diuretic such as furosemide, for example. Furosemide, one of these medication, may cause gout. Hydrochlorothiazide may cause gout also. So we have may cause the gout. Ethanol may cause gout. Ethambutol and pyrazinamide, these two medication used for TB, for tuberculosis treatment, may cause gout and hyperuricemia. Nicotinic acid belong to the vitamin B3, or another name niacin. This medication used for treatment of hyperlipidemia may induce gout. Tumor anti-cancer drugs, cytotoxic drugs, may induce gout. Salicylic acid with a lower dose, less than 2 grams per day, may induce gout. Testosterone and cyclosporin. Cyclosporin, a medication used as immune suppressant to treat maybe or to prevent organ transplantation. So you can see here we need to review the patient chart, the patient medication. We need to ask the patient, do you take any medication? Do you take diuretic? Do you take medication for TB? Do you take medication for organ transplantation? Do you take medication for cancer? So all these medications may induce gout and hyperuricemia. Okay. Okay, next slide here, maybe speaking about the complication of gout. What happened if you left gout without treatment? The patient may suffer from complication of gout. For example, we have patients suffer from hyperuricemia. If left untreated, the patient may suffer from gout. So hyperuricemia lead to the gout. The hyperuricemia may lead to the kidney stone, urolithiasis. Hyperuricemia may cause acute kidney injury. Hyperuricemia may cause chronic kidney disease, CKD. Hyperuricemia may cause cardiovascular risk factor and increase hypertension. So all these represent complication of gout, and this mandate the treatment of gout in order to avoid complication and the maybe consequences, negative consequences of hyperuricemia. Goal of therapy here, we recommend the therapy for the gout or hyperuricemia. Number one, to reduce pain. Number two, reduce disease progression. Three, reduce complication, prevent complication, and enhance quality of life. Non-pharmacological approach, we recommend patients to, if they suffer from obesity, according to the body mass index, we recommend patients to decrease weight. We recommend healthy diet. We recommend avoiding overuse of alcohol, practice exercise, physical exercise, smoking cessation, and appropriate hydration, enough fluid and water. This is for non-pharmacological approach. Regarding pharmacological treatment, the first line treatment for the gout will be allopurinol, zilobrine, and zilobrine is like this allopurinol tablet. You can see it here. So this medication lower urate, lowering the uric acid. How this medication work? The allopurinol inhibit xanthine oxidase. Allopurinol considered xanthine oxidase inhibitor, XOI. This is the allopurinol inhibit, considered like xanthine oxidase inhibitor, and this one considered like purine analog. The allopurinol, by inhibit this enzyme, this will lead to the reduced production of uric acid. How this medication work? Allopurinol, as you can see from previous slide, inhibit the last two steps of uric acid biosynthesis. Okay, so the situation here, allopurinol inhibit two-step synthesis of uric acid. So as you can see in this slide here, allopurinol, the first medication, allopurinol, inhibit xanthine oxidase in two final steps of uric acid formation. So you can see here the result will be when you have this pathway, we have increased level of uric acid and crystals formation. So our medication allopurinol and other medication febuxostat inhibit two steps of synthesis of uric acid, xanthine oxidase on step 1 and xanthine oxidase step 2. Okay, moving to the therapeutic uses, this allopurinol used for treatment gout and hyperuricemia, that's fine, and this could happen as a secondary to the other condition. For example, if the patient suffer from malignancy and patient treated with anti-cancer drugs, for example, if the patient suffer from renal disease, and this will lead to the accumulation of uric acid in the urine, and we use allopurinol to inhibit synthesis of uric acid. Now we need to remember allopurinol, what they consider like first line therapy for the gout and hyperuricemia. How this medication work? Inhibit the last two steps of biosynthesis of uric acid. Okay, the pharmacokinetic, the allopurinol, zilobrine metabolized to the oxyburinol. Also is considered this one oxyburinol active xanthine oxidase inhibitor, and it has half-life 15 to 18 hours, and this explains why you prescribe allopurinol once daily dosing. Those need to be adjusted if the patient suffers from renal impairment. We're looking on the glomerular filtration. If we have glomerular filtration less than 30 milliliter per minute, so in this case we need to adjust the dose, and here what we mean decrease the dose according to the renal function. Okay, this is number one. Number two, we have very most common cases related to the allopurinol treatment, hypersensitivity reaction. So two things need to be taken into account. Number one, adjust the dose in patients with renal disease. And number two, most common side effect, hypersensitivity. Okay, moving to the number three, this is important here. Some patients may suffer from acute gouty attacks during the treatment with allopurinol, and if the patient suffers from acute gouty attack during treatment with allopurinol, we can treat the patient with the NSAID, we can treat the patient with the corticosteroid or with colchicine. So we have three medications could be used to treat acute attack of gout, such as NSAID, this is number one, followed by cortisone, and the last option will be colchicine. Even if colchicine considered like most potent, but we consider like last resort, last option for us. We are going to explain why. Okay. Febuxostat Uric is very similar to the allopurinol. Unrelated to the structure of allopurinol, but similar with the mechanism of action, inhibit xanthine oxidase. So febuxostat inhibit xanthine oxidase. Advantages: less hypersensitivity. Its advantages: less adjusted needed for the patient with renal impairment. That's great. What happened with the warning and precaution? This medication may cause acute gout attack, such as gout flare. This medication may cause cardiovascular event and thromboembolic event and maybe death, cardiovascular death, and this is important. This medication may cause hepatic failure, therefore we require liver function test on periodical time, or like every 3 to 6 months, to monitor the liver function. So I will repeat in general what we have about febuxostat. Febuxostat similar to the allopurinol by inhibit the xanthine oxidase. Febuxostat inhibits synthesis of uric acid. The advantage: less hypersensitivity, no less needed to adjust the dose in patient with renal dysfunction. But this medication may cause acute gout attack. This is similar. However, this medication may cause cardiovascular event and death. We have warning from the FDA. This medication may cause hepatic failure. Therefore, we need to monitor the liver function. Uric and febuxostat. Okay, we can see here the FDA black box warning: increased risk of death with gout medicine, Uric, febuxostat, and we can click on the link here and we read information about that. Okay, so now we have the results showed that overall uric didn't increase the risk of combined event compared to the allopurinol. However, the outcome were evaluated separately. Uric showed an increased risk of heart-related death and death from all causes. So we need here to remember that febuxostat may increase risk of death. Okay, so we covered two medications. The first medication was allopurinol, and the second medication febuxostat, and we compare between these two medications. Okay, moving to, we have some literature here to maybe review it at your own time. For example, this gives you the information about febuxostat and allopurinol. For example, here you can see the allopurinol drug information. We have 17 pages according to the allopurinol, Zolobrim 100 milligram tablet, and available also like 300 milligram tablet. We can read everything about the medication Zolobrim, allopurinol. Okay, we're done with the two medication inhibit synthesis. Now we move to medication, another group of medication, and increase excretion of uric acid in the urine. So the probenecid considered like oral uricosuric drugs. This group of medication, probenecid, increase uric acid excretion in urine. Okay, how this medication work? This medication promote renal excretion of uric acid, enhance excretion of uric acid in renal. Okay, is this medication first line? No, this medication alternative to the first line. Therefore, this medication considered like second line treatment. So the first line treatment will be xanthine oxidase inhibitor. This is a second line treatment. Probenecid, second line treatment for the gout and hyperuricemia. We don't use it normally as a monotherapy. Probenecid monotherapy, we try to avoid this one, this medication. If the patient suffers from elevated the level of uric acid, and we don't recommend to use it. So if the patient comes to the clinic with a urine test and they found elevated uric acid in the urine. We don't recommend to use it due to the increased risk of uricosuric induced urolithiasis. Okay, so urolithiasis here we talk about kidney stone. Okay, moving to the drug number 4, lisinurad, zorambic. Lisinurad considered like selective. Lisinurad considered like selective uric acid reabsorption inhibitor, and this also increase excretion of uric acid in urine. How this medication work? Inhibit the function of two transporter, urate or urate 1 and OAT4. This two transporter responsible for transport uric acid and eliminated in the urine, and this medication inhibit two transporter urate 1 and OAT4, and lisinurad zorambic used in combination with xanthine oxidase inhibitor. Okay, so this medication for the clinical use, this medication used in combination in patients with gout who have not achieved the target with a uric xanthine oxidase inhibitor. So, for example, you prescribe allopurinol to your patient, but the patient did not respond well or not control on the doses of allopurinol. You can add lisinurad. And for this reason here, if we have a combination of treatment, they put it in one tablet now in the market, and the brand name Desalo. So we try to remind us we don't use lisinurad as a monotherapy only. So normally we use it as a combination therapy. Okay, as a combination therapy, we have a tablet, as you can see it here, Desalo, like allopurinol and lisinurad. This is combination treatment when we have hyperuricemia, uncontrolled hyperuricemia. So the patient on one treatment, for example, you prescribe allopurinol, there is not enough control for the patient. We can move to this combination, Desalo. It's like lisinurad and allopurinol in patients that are stabilized on certain dose of each combinant with a concern for pill burden or medication adherence. You can see here we have combination treatment between two medication. This medication may cause acute renal failure. Therefore, hydration is like we need to be emphasized to avoid risk of acute renal failure. Again, we can click on the link here to review Desalo together, and this is the Desalo here. Okay, so this is the Desalo for the information here. You can see it. Desalo, lisinurad, allopurinol tablet for use, and we have warning for that. Indication combination, Desalo combination of lisinurad. Let me maximize this one here a little bit. A combination of lisinurad, urate 1 inhibitor, and allopurinol xanthine oxidase indicated for treatment of hyperuricemia associated with gout who have not achieved target of uric acid level on medication on daily dose of allopurinol. So you prescribe allopurinol, but there we don't have enough response. We add this combination treatment, Desalo. Okay. Okay, moving to the next. So now we have regarding the increased excretion of uric acid in urine. Number 1, I will repeat. Number 1, probenecid. Number 2, lisinurad. Number 3, we have Desalo, combination lisinurad and allopurinol. Okay, moving to the next medication. Here we have alternative therapy, big luticase, Crystisca. Okay, Crystisca here, big luticase, alternative treatment. We don't use it as maybe first choice. This is a recombinant uricase intravenous injection. You can see it here, expensive medication, and this convert uric acid to the water-soluble allantoin. So you can see here this medication convert uric acid to another substance called allantoin, and we have the mechanism of action. Next slide. This medication used for chronic gout, for the refractory gout, for patient intolerance to the other urate lowering therapy. This medication, when they prescribe this medication, rapidly lower urate level. When you use this medication, we need to stop the other medication. Bigluticase is available 8 milligram. You can see it here. It should be given every 2 weeks, and this should be in the healthcare facilities. Okay, speaking about the mechanism of action of bigluticase, speak about bigluticase mechanism of action, Christeska, bigluticase. You can see here we have bigluticase. Bigluticase considered like analog, mimic the effect of enzyme called uricase. This enzyme is not available in the human body. They found this enzyme available in animal, and the animal maybe has the ability to transfer uric acid in the blood to the another substance, water soluble substance called this substance called allantoin. So bigluticase enhance conversion of uric acid in the blood to another maybe substance less harmful and lead to eliminated in the urine called allantoin. So a bigluticase is considered like enzyme convert uric acid to the allantoin and increase excretion in water. And this explains the mechanism of action of bigluticase. Okay, we're done with the two group of medication. The first group of medication inhibit synthesis and formation of uric acid. We have allopurinol, we have febuxostat, and the next two medication, medication number 3 and 4, we have allopurinol, then we have lesinurad. Two medication enhance excretion of uric acid in the urine, and there is a risk of urolithiasis or kidney stone. However, when the patient suffer from acute gouty attack, okay, so the medication will be maybe go with the maybe the drug of choice will be NSAID, so such as ibuprofen, diclofenac, naproxen, piroxicam, and here I refer you to the lecture related to the NSAID, non-steroidal anti-inflammatory drugs. So the drug of choice for acute gouty attack will be non-steroidal anti-inflammatory drugs. Number 2 will be also for the acute gouty attack will be corticosteroid. So corticosteroid will be number 2. Number 3 will be colchicine. Colchicine number 3. So we have 3 medication for acute gouty attack: NSAID, cortisone number 2, and we have number 3 colchicine. Colchicine is used for acute gouty attack. It's neither uricosuric and nor analgesic. Colchicine mechanism of action: black cell division, binding to the meiotic spindle. As we mentioned here, we use it for acute gouty attack. Sometimes if the patient take allopurinol, the patient may suffer from acute attack. We use it with the allopurinol to prevent acute gouty attack. Okay, colchicine, we don't prefer colchicine. If you go back, you can see here the first option NSAID, the second option will be glucocorticoid, the last option will be colchicine. The reason we don't like colchicine, or we put it in the third place, colchicine, because of the chronic administration of colchicine may cause myopathy, may cause neutropenia, may cause plastic anemia, may cause alopecia. This is a chronic use. If you use it, the patient, you can see the early sign or adverse effect. This may cause nausea, vomiting, abdominal pain, and diarrhea. Okay, this medication should not be used during pregnancy, should not be used in patients with hepatic disease, renal disease, cardiovascular disease. We can see a lot of limitation for this colchicine and acute gouty attack. Therefore, we recommend NSAID or the corticosteroid as alternative treatment here. Okay, so what else here? Do you have other medication? Yes, we have some medication could be used. For example, we can use interleukin-1 inhibitor. We have biological factor, interleukin-1 inhibitor. We have anakinra, and you can see the pre-filled syringes here. And this medication very expensive, and this medication prescribes one injection per day, and this is the last line therapy for the hyperuricemia and gout. And this medication considered like immunosuppressant agent. Okay, next we can use NSAID for acute gouty attack. We have list of medication here. We refer you to the lecture of NSAID. We have diclofenac, we have ibuprofen, we have indomethacin, we have naproxen, solindac. We need to take in consideration cardiovascular disease and edema, pregnancy. Then we have celecoxib, COX-2 inhibitor, and they try to remind us with the contraindication. Cortisone could be used oral or IV. We need to remember cortisone may increase risk of hypertension, diabetes, elevated level of glucose, metabolic signs. All these considered maybe as risk factors or adverse effect. We have cortisone injected in the joint, into the joint. We have intra-articular, that means we inject the joint with the cortisone, and this will give like temporary relief of symptoms. Okay. The question now, which of the following medication used for acute gouty attack? NSAID number 1, number 2 corticosteroid, and number 3 colchicine to relieve the pain. Which medication used to lowering uric acid, lower uric acid? We have xanthine oxidase inhibitor, allopurinol, febuxostat, lowering uric acid by inhibit the enzyme. Lower synthesis of uric acid, we need to remember that. Let me clean this one again. Okay, lower synthesis of uric acid. Okay, we have other medication, increased excretion of uric acid. So increased excretion, we have probenecid, we have lesinurad, and we have another last medication, pegloticase, IV medication, and this medication inhibit uricase, and this could be also last line treatment for the hyperuricemia and gout. Okay, this table here summarize the drug generic name, the drug brand names, pharmaceutical forms used in the treatment of gout, and this is like chronic, long treatment, or it is for acute gouty attack. So we can ask question now. Which of the following medication used for acute gouty attack? Okay, maybe someone may speak about methylprednisolone, prednisolone, naproxen, indomethacin, colchicine for acute gouty attack. And you remember we have the group of medication here, 1, 2, belong to the NSAID, and prednisolone and methylprednisolone belong to the corticosteroid. Okay. Which medication used as long-term uric acid lowering? We have allopurinol, febuxostat or febuxostat. Okay, this concludes our lecture for the gout hyperuricemia, and we cover the group of medication. We cover the acute and chronic treatment. We cover the first and the second treatment. We cover the medication used for acute gouty attack. Thank you so much for your listening and watching this channels, and have a great day, everyone.